The industrial action taken by mental health workers have been placed on pause as union representatives say government has shown a commitment to meeting workers' needs. President of the Public Workers Union Brian Grimes confirmed that 6 of the 10 community health workers have already received their claims, and Permanent Secretary for Mental Health and Wellness Naomi Jeremiah has made promises in a public forum to address the workers' plight.
It was stated that the minister has spoken to workers. What are we saying? There is no purpose for the union in this dispensation. The workers here have a bargaining agent in the form of our union as others in other workplaces. So a minister, in our respectful view, ought not to say interaction with the workers is enough. They have a legal and official bargaining agent and representative that, in terms of negotiation and collective bargaining, is very, very important in the process. So we are concerned about this. We would like to know if this is the new trend, the new culture in this dispensation where ministers feel that the union is just an accessory and they don't have to meet.
Although he applauded government officials for their declaration to resolve the issue facing workers, the PWU president stated that some of the information indicated by the Permanent Secretary for Health was not fully accurate.
There are a lot of things that we considered inaccurate. We would not, on a public platform, say the PS was lying. The PS is actually our member. But we will just say that we detected some inaccuracies in her presentation on behalf of her, right? So the first thing, there was an attempt to make it look that the workers here have received or are receiving extreme amounts of allowances unique to them and so forth. So for example, they spoke about subsistence allowance. Subsistence allowance is $210. All nurses basically get subsistence. Then there was talk about uniform allowance. If one is not listening keenly, one would think the 750 uniform allowance is per month. It is per annum. So when you break that down, that is basically $62.50 a month.
Grimes, who is again calling for dialogue with the Minister for Health, Jonathan Lacrett, on charting the way forward, also pointed out that he is disappointed with government's move in sidelining the union in the negotiation process.
Demonstrable action to pay. 50% of the workers received mileage from last year, and claims are continuing to be sent in and processed. Public declaration and commitment to make the workers designated traveling officers based on what they have to do. So we deem those things as positive and enough to make us to put a pause on the industrial action and really seek social dialogue, have a sit down, and so both parties can understand each other.
For GBN News, I am Rena Pett Thomas reporting.